On this episode, we'll talk about if you really need to be overweight to get a sleeve to alleviate gastroparesis. We'll also talk about if you only need to lose about 60-70 pounds, is the sleeve right for you? And how about how much weight do you really need to lose before getting a gastric sleeve? Hello everyone, I'm Dr. Alvarez with Endobariatric.com. Welcome to episode 244 of the AskDrA show. Thanks so much for joining us. Thank you for the show. Thank you for sending me your questions that we are answering today. And if you want me to answer your questions, you are welcome to send them my way. There's one way to get those questions to me, and that is to use the hashtag AskDrA throughout social media. Please use the hashtag, because otherwise we can't get to those questions. And to invite you to maybe hit that subscribe button if you're looking into gastric sleeve content, weight loss surgery content, just weight loss in general. That is what the channel is about. So without further ado, let's get into the show. All right, so the first question is, do I really need to be overweight to get a gastric sleeve to alleviate gastroparesis? Now, gastroparesis is a situation where the stomach is not working or is working slower. All right, so the motility is slower, and that is gastroparesis, and it's very common. It's a very common situation, specifically or more toward diabetic patients, like long-term diabetic patients. And gastroparesis does get better. It does by getting a sleeve. A sleeve does alleviate. There are several studies on this. We've done patients that we do a sleeve because patients have gastroparesis, but you do need to be overweight or suffer from obesity to be eligible to get a gastric sleeve, even though you have gastroparesis. Because in this particular scenario, the patient is not overweight, actually toward underweight, and they are looking into a gastric sleeve just to alleviate the gastroparesis. But no, the gastric sleeve will help the gastroparesis, but guess what? The gastric sleeve is designed to make you lose weight, and it will happen. So a patient who is in a low BMI there, normal toward underweight, a gastric sleeve is not indicated in this precise case. Gastric sleeve is indicated in patients who are obese, or you may be just slightly overweight. You may be overweight and suffer from diabetes and suffer from gastroparesis. That's a good candidate. If this doesn't make sense, go ahead and touch base with my office. We will be more than happy to let you know if this is right for you. Actually, I'll let you know. All right. So the second question is, what if I only need to lose 60 to 70 pounds? Would the sleeve be enough? The answer is yes, definitely. So of course, I'm missing some things from the formula in this scenario, because I'm seeing that you need to lose 65 to 70 pounds. Yeah, but if you are 6'5", I mean, 65 pounds is nothing. Make sense? But if you're 5'2" or 5'1", needing to lose 65 pounds is everything. So I am missing some things from this precise question, but to answer your question, is a sleeve enough to make you lose 65 to 70 pounds? The answer is yes, most definitely. And the last question is, I would like to know how much weight I need to lose before getting surgery. As you know, we advise patients to do a pre-op diet like most bariatric offices or bariatric surgeons out there. And this is designed not to give you just a headache or just to be, for us to be stubborn and to give you a hard time. No, no, no. To make you lose weight before surgery creates a safe environment, creates a safe surgery, creates a safe outcome. Because losing some weight before surgery will make you lose some visceral fat around the organs, which we will be in there. And the more fat you lose, the more space we have, and the better we can manage the tissues and the better outcome we will have. So yes, most definitely, losing some weight before surgery is a must, and that helps you tremendously, you and your surgeon. So how much is enough? How much surgeons are expecting the patient to lose weight before surgery? So we make an estimation on how long you need to do that pre-op diet, that diet before surgery. Is it 3 days? Is it 5 days? Is it 7 days? Is it 10 days? Is it 2 weeks? Is it 3 weeks? Is it 4 weeks? Is it 5 weeks? So it all depends on your BMI, your body mass index. So how high that BMI is, the higher the BMI, the higher the risk, the higher the risk of surgery, and we need to get it down faster, quicker, in a shorter period of time, and maybe 5 weeks or 4 weeks is more than enough time. But as your BMI is lower, you don't require to do that much, that many days as a pre-op diet. We expect you to lose between 5 and 10% of your current weight by the time you get surgery. I'll give you an example. So let's make believe a patient weighs 300 pounds and they want to know how much they need to lose before, or their optimal weight loss before getting surgery. 5 to 10%. So 10% would be 10% of 300 pounds would be losing 30 pounds prior to surgery. 5%, 15 pounds. All right, so this patient needs to lose between 15 pounds and 30 pounds before getting surgery. I hope this makes sense. All right, so there you have it. That is it for episode 244. Did you like the content? If you can leave me one of these, I'd greatly appreciate it. It helps us a lot here with our YouTube algorithm. And don't forget to hit that subscribe button. That way we can hang out again. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care. God bless.